Caffeine during pregnancy is a controversial topic. Some people say it's perfectly safe, while others believe it can have harmful effects on the developing baby. Caffeine is a stimulant found in coffee, tea, energy drinks, and chocolate. It's also added to some cold and flu medications. Is it safe to drink caffeine during pregnancy? Caffeine is a stimulant, and it's not recommended that you consume it in large quantities when you're pregnant. Although there is no definitive answer on how much caffeine is considered safe during pregnancy. If you're pregnant and you're concerned about your caffeine intake, talk to your doctor or midwife. They can help you determine how much, if any, caffeine is right for you. What is the safe amount of caffeine during pregnancy? The American College of Obstetricians and Gynecologists, ACOG, recommends limiting caffeine intake to 200 milligrams per day during pregnancy. This is equivalent to about 1 to 2 cups of coffee per day. ACOG advises pregnant women to check food labels for caffeine content and consider avoiding foods and beverages that contain high amounts of caffeine. What foods and drinks contain caffeine? Caffeine can be found in coffee, tea, some medicines, energy drinks, and chocolate. What are the effects of too much caffeine during pregnancy? Number 1. Miscarriage. Number 2. Low birth weight. Number 3. Stillbirth. Number 4. Premature birth. Number 5. SIDS, sudden infant death syndrome. Is caffeine during pregnancy linked to autism? There is currently no definitive answer to the question of whether or not caffeine is linked to autism. However, there is some evidence that suggests that it may be a contributing factor. One study found that pregnant women who consumed high levels of caffeine were more likely to have children with an autism spectrum disorder. However, it is important to note that this study did not prove causation, and further research is needed. Caffeine is a known stimulant, and it is possible that excessive intake during pregnancy could disrupt the development of the nervous system. Additionally, caffeine is often consumed in other foods and beverages such as coffee and soda, which may also contain other chemicals that could be harmful to the developing fetus. Until more research is conducted, pregnant women should moderate their caffeine intake to reduce the risk of potential harm to their children. Is caffeine during pregnancy linked to ADHD? Is caffeine during pregnancy linked to ADHD is a question that has been asked by many pregnant women. There is no one definitive answer to this question. Some studies have shown a correlation between caffeine consumption during pregnancy and an increased risk of ADHD in children. Other studies have found no such correlation. The jury is still out on this issue, and more research is needed to determine whether there is a causal link between caffeine and ADHD. In the meantime, pregnant women should talk to their doctor about their caffeine intake and how it might impact their child's health.